My name is Jalen Glass. This is my presentation for the process of conducting a therapy session. This presentation explains the therapy process step by step, following five main stages: relationship building, assessment and diagnosis, goal formulation, intervention and problem solving, and termination with follow up. The content emphasizes social work's disposition number 6, focusing on competence, and highlights how social workers apply professional ethics and skills to ensure effective and ethical practice. This presentation outlines the therapy process, emphasizing competence, communication, and ethics. Competence involves practicing with professional boundaries while continuously developing skills through education and experiences. Successful therapy also depends on strong communication abilities, highlights, Koprowska, I'm hoping I'm saying that name right, highlights that professional empathetic conversations are essential for building trust and achieving positive outcomes. Such skills support client engagement and ensure sessions remain focused on the client's needs. Our textbook provides the framework for integrating these elements into a structured, effective process. Therapy follows a 5-stage structure that offers clarity and direction. The process includes building rapport, assessing needs, setting goals, applying interventions, and concluding with follow-up to ensure progress and accountability. According to Kaprowska, 2020, in the video, each stage requires intentional communication suited to the client's situation, making active listening, empathy, and reflection key skills for effective ethical practice. Stage 1 is relationship building. The first stage centers on building a strong therapeutic alliance. Kaprowska emphasizes that professional conversations are intentional, goal oriented, and focused on the client's needs. Using effective listening, empathy, and reflecting back helps clients feel valued and understood. Reviewing confidentiality at the outset is essential for fostering trust. And in layman's terms, basically making sure that telling the client that all of everything that's being said in the therapy session is confidential and it won't go out of the room, basically. Demonstrating competence in this stage involves self-awareness, cultural sensitivity, and authenticity, ensuring the relationship provides a safe and supportive foundation for the work ahead. Stage 2, which is assessment and diagnosis. This assessment involves gathering detailed history and identifying concerns using interviews, observations, and standard tools. Kaprowska highlights the importance of adapting communication to client-specific context, whether engaging with children, adults, or families. This stage demands accuracy, objectivity, and cultural sensitivity to ensure ethical and effective diagnosis. Competent practice means considering the client's unique circumstances while applying professional knowledge and skills to develop a clear understanding of their needs. So we need to gather personal and social history, identify presenting concerns, use assessment tools and interviews, and also consider the cultural and contextual factors. In stage 3, formulation of goals. So goal setting is a collaborative process that helps ensure the client's full investment in their progress. Kaproska stresses the importance of matching communication style to the client's readiness for change and confirming mutual understanding at each step. So making sure that everyone understands what the next steps are. Goals should be specific, measurable, achievable, and relevant and time bound. Uh, Basically, making sure both motivation and accountability. This stage requires the social worker to balance professional expertise with clients' priorities, creating a plan that is realistic and meaningful. So we need to collaborate with the client, set realistic and measurable goals, address immediate and long-term needs, and ensure goals match client priorities. Stage 4 and intervention and problem solving. In this stage, the social worker implements interventions tailored to the client's specific needs and goals. Kaproska explains that effective intervention relies on ongoing feedback and adjusting both communication and techniques according to the client's responses. Competence involves selecting strategies grounded in research and professional training while maintaining flexibility to adapt as situations involve and client circumstances change. So use evidence-based interventions, teach coping strategies, address barriers to progress, and adjust methods as needed. Stage 5, termination and follow-up. Termination should be constructive and empowering process for the client. Reviewing progress reinforces achievements while offering resources or referrals. Promotes continued personal growth. Scheduling follow-ups to help maintain long-term success and addresses any emerging needs. In the video, Kaproska emphasizes that sensitive conversations, particularly at the close of therapy, demand empathy, clarity, and professionalism to ensure clients feel supported, respected, and confident as they move independently. So we need to review progress and achievements, prepare clients for closure, and provide resources and referrals, and also plan follow-up sessions if needed. All right. And my final thoughts, therapy is most effective when it follows a clear structure, is grounded in ethical principles, and incorporates strong communication skills. The 5 stages include relationship building, assessment, goal formulation, intervention, and termination with follow-up. This framework supports progress and client-centered outcomes. Competence, defined as practicing with one's abilities while continually enhancing professional expertise, is vital. And that is coming from the NSAW, I'm sorry. Kaproska also emphasizes that communication, empathy, and reflection are key to building trust, fostering collaboration, and successfully achieving goals identified in therapy. And that comes from our textbook. So my final thoughts, therapy is structured and ethical. Communication skills are critical. Competence ensures quality care, and ongoing learning benefits both the client and the social worker or the worker. These sources inform the concepts, communication strategies, and ethical principles discussed in the presentation. Kaproska's video offered practical examples of purposeful conversation and empathy in action. Our textbook provided the framework for therapy stages, and the NASW Code of Ethics reinforced the importance of competence in practice. Thank you so much for listening, and yeah, thank you.